Hi, this is Forrest Lightboard with the Santa Barbara Response Network. I'm here with a few very special guests from the Family Service Agency, as well as Gina Carvalho from, well, she's a co-founder of the Santa Barbara Response Network. Today's topic in this Compassion Center, this Monday's Compassion Center, is senior mental health during COVID-19. Our guests are Marco Quintanar, as well as DeAnn Rosenberry. We're both from the Family Service Agency. And Marco, just a little bit about them here is Marco was born and raised in Mexico City. He has a BA in journalism and communications from the University of Mexico. He's been living in Santa Barbara for the past 30 years, the same amount of years that he's worked in the health industry. He's worked as a CNA, medical records director, and senior case management. For the past 10 years, he's worked for the Family Service Agency, currently serving as the program supervisor for the long-term care ombudsman, correct?
Yes.
Ombudsman program of Santa Barbara County. He's been a volunteer in several organizations, including the Santa Barbara Response Network, Listos and Leon, which is the Latino Elder Outreach Network. He's been the president of the Latino Elder Outreach Network for the past 6 years and had the vision of Dia de los Abuelos that is celebrating its 7th anniversary this year. Excuse me, I don't speak Spanish, so you'll do a better job than I do.
You did very well.
And
you did very well.
Our other guest is DeAnn Rosenberry, who's the Senior Services Program Manager for the Family Service Agency, serving seniors and caregivers throughout the county of Santa Barbara. She has spent 3 years at Domestic Violence Solutions before joining the Family Service Agency in 2013, where she provided therapeutic services to all ages. Dee maintains a small private practice in Solvang and is also a former adjunct faculty member at Pacifica Graduate Institute here in Santa Barbara. So I want to welcome them both, and I also want to welcome Gina here. So I'm going to pass this on to Gina for a brief moment, and then we'll get the ball rolling and talk about senior mental health.
Thank you, Forrest. Thank you, Marco and Dee, for being here. This has been an issue that I've wanted to highlight for some time. I'm a senior. My husband is an 87-year-old senior. So we've been quarantined. We've been having to be very careful. We're the vulnerable population. And with that comes so many concerns for mental health, physical health. And we always talk about our vulnerable population. So I wanted to really spend some time and talk about what are we looking at when we talk about senior health during these times. And our partnership with Family Service Agency goes way back. So I'm really honored to have both of you here representing FSA. It's a wonderful partnership and an agency that I'm just so happy that exists in Santa Barbara with all the services you have. So I just want to say personally, this means a lot to me, and look forward to the conversation with both of you. So thank you for joining us.
You're welcome.
Thank you.
Thank you.
All right.
Thank
So
you.
the first question I want to ask you both is, what issues and concerns are you seeing with seniors in particular during the COVID crisis?
Do you want to go first, Marco, and talk about the seniors? Or?
And just a note to our listeners here, if you have any questions at any time, feel free to chime in and enter them in the Facebook chat.
And I believe that we can start
Thank
with Dee, what
Okay.
FSA is doing for mental health for seniors.
Okay. All right. So what we're seeing is that was your question. What issues and concerns are we seeing as far as seniors nowadays in our community?
Correct.
Good question. Valuable question. So the immediacy of the needs are the basic needs at first. So folks are looking for food and groceries and adult hygiene materials. Once those basic needs get met, then we've noticed they're starting to reach out a little bit more for the emotional support or the mental health support. And we are seeing a little bit of surge in that now. But again, I have to reiterate that for the most part, what we've seen so far up to date have been, I need help. We get phone calls with, I need help. I haven't had groceries in 3 weeks. I'm alone. I'm isolated. So those are a couple of things. So the mental health issues are also coming up, and that fear of isolation, not being connected to folks. So we've shifted and pivoted all of our mental health services over to telehealth and video conferencing, which has been quite successful. Seniors like to talk on the phone for the most part. So we thought that perhaps they might not enjoy the long phone calls, but they are really enjoying them. It's our way of helping them stay connected. So that's one of the things, is that their basic needs, and then also keeping them connected to us with their current therapists, and then expanding that.
That's wonderful. You know, Marco, I was just thinking that you and I were talking before about the nursing facilities, that you have a lot of contact with some of the skilled nursing facilities. Are you seeing some of the same things, Marco, or what are the issues there that you're seeing in those facilities?
Yes. What I can say is that in our program, we visit all the nursing facilities and assisted livings and independent livings in the county, all the way from Carpinteria to Santa Maria. We cover the whole county. It's 133 facilities. And now we're not able to visit them because of the health order that will end until, it's effective until May 31st. So what we were seeing before COVID-19 is that residents were somehow isolated anyways. They receive visitors, of course, but not all of them. Our program with our volunteers and staff, we were doing that weekly visit, that monthly visit, walking around the facility, talking to the residents. And that was a presence that meant something for them. They were calling to our office to talk to us, besides the other things that we were doing for them, that it's advocating for their rights is very important. But we were seeing the isolation, and it's hard for someone to be in a nursing facility. I can tell you that no one wants to be in a nursing facility. There is no place like home, even if there is no home. And Dee and I were talking about these situations before COVID-19. We were also reaching out for a professor in UCSB who has a project of virtual reality, trying to connect the residents with the family members. And then COVID-19 hit. The health order is in place. Visitors are restricted. We cannot visit now, but we're making phone calls and with our volunteers and staff. And this is part of what all of us, we are doing the Zoom, the FaceTime, and others. So that's how we are connecting with them. But I believe that COVID-19 just brought more isolation into nursing facilities because there is not that human touch from the outside.
Yeah,
It's hard.
absolutely.
Mm-hmm.
Yeah, it is. It is.
So what resources and information would you find valuable and useful to share with seniors today, specifically?
That's a great question. I'll jump in on that one. So fortunately, about a month ago, FSA was contacted by a generous donor who offered to give FSA, not FSA money, but for FSA to be the coordinator of the donated funds. And so we've had several other organizations join on top of that. And so we have been given about $100,000 that we are giving to the other agencies around the county. So we've got the Family Service Agency, Central Coast Commission for Senior Services, Center for Successful Aging, Community Action Commission, Carpinteria Children's Project, Community Partners in Caring, Cuyama Valley Family Resource Center, Lompoc Valley Medical Center, Lompoc Valley Community Healthcare Organization, San Ynez Valley People Helping People. So we have this huge, vast county-wide network of agencies that have gone into our own communities, and that's what the flyer is also for, to reach isolated seniors, to see what their basic needs are. So we designed a flyer for each regional area: Santa Maria, Lompoc, San Ynez Valley, and Santa Barbara, and including Carpinteria and the other places, Cuyama, that I mentioned. And so the point of this is to reach those isolated seniors that would not otherwise have any other support. And so through media and PSAs and video spots and news press releases, we're trying to reach those folks that need the food, need the adult hygiene, need even prescription delivery, and anything else.
Right.
I got a phone call the other day from one of our therapists that one of her clients needed those tennis balls for her walker. And so we were immediately able to go out and purchase an item like that, given this funding, because normally our funds are from the Area Agency on Aging, and it's typically just for mental health. Because of this, gives me goosebumps, this large donation, we're able to actually meet seniors where they are and try to kind of help alleviate some of that burden. And in turn, their caregivers are also finding the benefit from this, because some of those worries that they would have to find and take care of are now being supplied county-wide. You heard the list. It's just food and insurance help and signing up for Medi-Cal, you name it. If we can't figure out what you need and how to get it, we're gonna find someone and find resources to help our folks get what they need.
That is wonderful. Would this be a good time to put up the flyer, Dee, or this is so amazing?
Sure.
What a generous thing.
Sure.
Put up the flyer for to share what the services are, and then what numbers that people can call, because I know you're county-wide.
Yes.
So I know that you have. So there's a flyer. So how can we help? And it's English and Spanish.
Mhm.
And my eyesight without glasses, not great, but so it's everything, like the groceries, health needs. Oh my goodness. And then the number is down there, contact Senior Connections.
Yes.
And that's 925-9554. Is that correct?
And that particular number
we'll post
will.
that on our.
Great. There's also a way to contact Family Service Agency as well. 805-965-1001, and the extension is 408 for English and 407 for Spanish.
Okay.
But this is
Put
just
that up as well.
So thank you to our generous donor who wishes to remain anonymous, but there's several other agencies as well, or generous folks that have contributed to this. So
This is
silver lining in this.
So happy to hear.
Absolutely. Well, thank you.
Yeah.
So, hey, Marco.
Does this affect some of this? This is wonderful. Marco, would you, your seniors that are in, that you know of in facilities, can they also access this, or is that a whole different, pool of people?
Well, we can, when we call to the facilities, we ask them if they need any type of help, and then we can refer them to services like this one. Most definitely, yes.
Right. So they can access the needs they have there as well. So this supports even people in skilled nursing facilities if there's a need there. This is wonderful. Wow. I want to thank the benefactor, whoever that was, for this, because there's such a need for, I really feel for our isolated seniors. I really do. So this is wonderful.
And I need to mention too that the initiators of this were also the Wood Clayson and the Bauer Fund as well. And then there's a couple other folks that have joined in this project, and we may even get some more additional funding for this.
Good. Those are good people.
Excellent people, very community minded.
Yeah, they've been very supportive of our work as well. So I'm very grateful. Mm-hmm. And so if we know of a senior for instance, in our neighborhood, because seniors might not be comfortable on the internet, Zoom, but we may know of seniors that we're worried about. So we can call you and say, oh, I'm worried about my neighbor, you know, can you call or check in, that kind of thing. That's so important. Neighbor helping neighbor.
Absolutely.
So this should go.
Absolutely.
So we'll share this widely.
Good. And these flyers have been placed inside perhaps the food bank, grocery bags that are going out. So we're trying to get them to that group. We also had thousands of door hangers that have gone across the county. So again, getting the awareness out. Because you're right, seniors don't necessarily, they're not going out to places anymore. So we have to go to them.
Right. And even after, even after the lockdowns lift more, they'll still, I'm sure they'll still be advised strongly to stay home, or maybe even ordered to stay home for longer than the rest of the population, because because the virus will still be circulating after the lockdowns lift. So they're going to be in a unique position for a little while.
Right. And then again, if you think about it, you know, we're all experiencing this trauma, but the seniors especially, because they're so isolated and they may have to stay on lockdown even longer, that they might actually kind of begin to experience the trauma symptoms even before we get back out.
Before we get back, right. So it's so important to stay connected with them. Anyone listening that has senior family or friends and loved ones, just stay connected with their phone calls, right? Stay connected, because that there are health risks to isolation as well. So being mindful about that, and I just feel it's really important. So another question for you: what on this note, what tips or advice do you have for these seniors who may be feeling overwhelmed, alone, isolated, etc.? How can they navigate through this most gracefully?
Well, yeah, a great question. I'm just going to follow up too with what you just mentioned for us too, is that reach out, call someone, talk to someone, slip your neighbor a note. You know, I've heard of folks that drive into the parking lot and they ask people to go get groceries for them. So if you don't want to face with anybody, please just reach out to somebody. Someone is going to help you. We're all in this together. And I know a lot of folks feel so isolated. And there's so many people that want to help. So just getting the word out. And the tip is, you're not alone. It feels like you're alone, but you're not alone. There's so many people, so many resources that are here to help. You just have to ask. That's it. You just have to ask. And staying connected, keeping the connections with the folks that you have, even if it's pen pals or family members.
Yes, and may I add that maybe, like, if you know that your neighbor is a senior who needs help, and you can just print out this flyer and then put it in the mailbox or something, so they can see that the services are available. That's another way.
Absolutely.
Right, and to encourage other folks in the community too. You know, be bold. If you see a senior, keep your distance, but just say, hey, I don't know if you're experiencing something that we can help with, but I know of several agencies that you can call. So be bold. Just approach seniors respectfully.
That's beautiful. I really love the attitude that both of you have and the feeling that you have for these folks who are our wise elders. I mean, we as a community forget. I grew up in a Latino community like Marco, as Portuguese, but very much in the same tribe, you know. My grandparents and my elders were the ones we looked up to. And they were like pivotal in our community, in our village. And we can't forget that. I mean, these are the people that have, you know, worked for us and, you know, worked in our communities and made this what it is. And now let's step up, like you're saying, and reach out and say, hey, do you need a hand? Very important to remember those last as we say in Spanish, los abuelitos, las abuelitas, the elders, our elders. So very important. So your work is very meaningful to me. I grew up in that culture of not putting them away, but integrating our elders into our lives as best we can.
Mhm.
Thank you for your work.
And they tend to be kind of that invisible population, unfortunately.
Absolutely.
But they just don't get the attention, and they're not the first thing we think of. We automatically think of kids, which is great, and that's very common and it's important. And especially in times like this, these folks are alone and lonely and scared, and they don't have the technology typically to reach out. So they are just the most vulnerable right now.
Wow.
I totally. So important to have this conversation and share it widely, really.
And if I can just add one other thing too, Marco and I have had this conversation months ago, but there is this growing trend of population, the senior population being doubled by 2050, 2060. And Marco and I have talked about what are we going to do for those folks in the future? And this is almost I don't only want to say a blessing in disguise, but this is going to help kind of propel keeping seniors to be able to age in place and trying to maybe establish more of a communication network with our seniors, because they're this kind of invisible population. And so we're trying to leverage these moments and this time in this horrible thing to actually maybe promote increased communication and increased service response to these folks.
Yes, I agree
I
completely.
agree.
Like we were talking about that months before the COVID-19.
Yes.
We were talking about these situations of isolation. How could we help people in the community and in nursing homes? And then these hits, and you know, it's uh, it's it's really sad, but at the same time, it's an opportunity for us to start bringing these resources and this opportunity to start helping people from now on, because this is the beginning of something that will not end soon. Definitely.
Yes, definitely. And the more things we put into place. I had an idea I wanted to share with you. It's my own little creative thought. I work with, we've had CALM on, with children and everything, domestic violence solutions, teens, all these populations. And I've had a vision of a cross-generational outreach program where seniors love children and babies, but also little kids and youth. And I thought, what about having a project where there would be a pen pal to a senior, and it could be in the form of a card, a mailed card, it could be a phone call, it could be a FaceTime, and we would place seniors with the age of the person they would like to be contacted by, and they would be a pen pal, and they would check in on them once a week. And I just thought of that the other day. I thought I'd share it with you and see if it's even feasible, what your thoughts are on something like that, or if there is anything like that now.
I love that idea. I know I want to say the Friendship Center was having seniors and school-age kids share time together. So now that we can't meet face-to-face, but I think that pen pal is an amazing idea. Really, a phone call, a quick note.
That's all it is. A little note, it doesn't take much, and really highlight our senior population that's outside, and also our youth are feeling isolated, so that would give them a sense of purpose and meaning. So anyway, it was just an idea. I'll pursue it a little further and see if I can get something established with you guys.
That's great.
Okay.
I agree. Yes. And we were aware that there was this program through the district's attorney's office, that it was cyber seniors. They were trying to connect the high school children to teach technology to the seniors. We were talking about all of these things before COVID-19.
Okay. Cyber seniors. I love that. And that was with the DA?
Yes.
Okay. I was going to ask the DA's office to be on our program. I was going to ask Joyce Studley if she would be on. Next week, Wednesday, we're going to talk to police and sheriff, because mental health of the first responders is very much on my mind too. So there's a lot happening in that community. So we'll have them on Wednesday, but I'd like to have the DA's office on at some point to also talk about what's going on with them. So there's just so much we can talk about in these conversations.
So I
Yeah.
want to ask another question here. Just really generally, if you have anything more you'd like to share with seniors, families, and in the community at large, as we continue to navigate through these challenging times, do you have anything else you'd like to share or speak about, or resources you'd like to share about?
Well, I would like to say that it's the opportunity also for the individuals to start thinking in working for obtaining the power of attorney for healthcare and for finances. It's a legal document that it's important to have, and we see the importance now more than before. So during this time, it's good to start the conversation with family members about this. And also, there is the opportunity for training in facilities and in the community about mental health, the dementia, the Alzheimer's, the Lewy body, how to redirect our seniors. We are part of the baby boomers. We are non-stop until after year 2030. We are going to have more and more seniors per day, and who will need the help now or in the near future.
And Marco, I was curious whether you see any differences in trends in the Latino community, senior health, and the more English speaking community. Are there any big differences in what you're seeing? Just curious.
Well, at the end of the day, I can say that because of the language barrier, it was some kind of difficult to obtain the resources, and that's why Leon was trying to create that link between the seniors, the Latino seniors, and the resources in the community. But I believe that all the community, all the senior community has been affected by COVID-19, and they have the same type of needs that the food and the medications and others. It's so important to have that. And then mental health. I can say that it's a little bit more difficult for the Latino community, especially because they don't speak the language. They don't have the access that some of the seniors have for the technology, like laptops or other things. So it's going to take a little bit more work from our end to help them.
Yeah, great. Yeah, my parents are both 90 and they're living at home alone in Canada. So it's a good thing. There's a lot of resources in Canada. But they have a language barrier. They have no technology. They don't even have a cell phone. Okay, so I totally get it, Marco. It's very challenging, and I really, try to stay in touch with them regularly, see how they're doing, and have backup in case they need to go into some kind of situation for help. But the language, the lack of technology, the integration in the community as immigrants, it's always been a challenge. So we need to just keep putting that out there, that even though that's there, there's ways around it, and we can still get you help, and we can still assist you. There's just a few more hurdles, but that's okay. They're manageable. We'll work on it. Yeah, that's why I tell my folks, don't worry, we'll work on it. I get it. Yeah. So wonderful to have you both on. And do you have any other closing comments before we end? And Forrest, I don't know if you have any other.
I would like to add, if it's okay, that as I mentioned earlier too, this has all been very traumatic, but the general public doesn't necessarily use the word trauma. So I think it's important to note that what we are experiencing can be considered trauma. And so we may be so busy on trying to getting our food and our needs met and taking care of other people that we may not be paying attention to ourselves and noticing the trauma. And we know that it's here. We know that it's happening inside of our bodies. And when things tend to calm down a little bit, I think there's going to be quite a bit of backlash of that trauma that's kind of going to be creeping up and being exposed. So just keep in mind. Go ahead.
And the activation of old traumas, that's
Exactly.
that's happening right now.
Exactly.
I'm just putting up our SBR number. So
Nice.
our SBR number, I just put it in the chat box. It's 699-5608. At 699-5608. And what SBRN does is we do trauma response.
Nice.
And right now it's of course a little more challenging, but we have phone, we have FaceTime, we have Zoom, and we're reaching out to the community. So if anybody is experiencing exactly what you're talking about, trauma, fear, please feel free to call. We'll hook you up with services, whatever's needed. And we have several families that we're touching base with right now who are very traumatized and afraid. So reach out. You're right. The trauma that we're experiencing and the fear is going to be ongoing. And so self-care is so important right now, that we all take the steps to take care of ourselves as caretakers, especially, with our families and also our seniors. But so important because the trauma takes all forms and shapes. And so thank you for that.
And in addition to the emphasis on being safe and social distancing, especially for our seniors, an emphasis on good health and lifestyle seems to also be important. If one does contract the virus, they're going to want to have as strong of an immune system, as strong of a body as possible to respond to that. So,
so important. Our physical health. Yeah. Yeah. Thanks for that, Forrest.
So great. Well, it's been a real pleasure. If you feel that that this dialogue is complete, we can conclude it. Or if you have any further comments you'd like to make, feel free to. We've hit that 30-minute mark for this, so just want to make room for any final comments here.
Just reach out, ask for help. There's so many people that want to help. Just reach out, ask somebody, tell a neighbor, tell a friend, and there's somebody to help.
Absolutely. Yes. And what's the website link, by the way?
fsacares.org.
fsacares.org. Great.
Yes.
And we're posting that as well. So fsacares.org. So check it out. Gina, do you have any last words?
Check it out.
And Marco?
No, just gratitude. Tremendous gratitude.
Oh.
Marco?
No, thank you. I am impressed how the community is reacting, helping each other. It's amazing.
Yeah.
All the agencies getting together and trying to resolve, thinking out of the box to help the people who really need the help more than anybody else. That in this case is our seniors. Our seniors.
Absolutely.
Absolutely.
That
I love the way you said that. The creativity.
Yes.
All right. Well, with that, we're going to conclude this Compassion Center today. And I want to thank you all.
Thank you.
Marco.
Thank you.
And Gina.
Thank you.
And to our
Thank
audience.
You for your time and your work. Thanks.
Thank you so much. And to our audience, thank you for joining us.
Yeah.
Wish you well.
Thank you.
Thank you.